Question number 5 from American Select. What role should the federal government play in the healthcare industry, and is healthcare a right? Well, let's start with the last question again first. Healthcare technically is not a right under the Constitution. It's not referenced even in the Declaration of Independence. But if we reframe that question and say, is it possibly a moral imperative in a civil society, I think the answer becomes yes. So if we're looking for a constitutional basis, I would look to Article 1, Section 8, and see if we can apply general welfare of the United States as the constitutional basis if we don't amend the Constitution to reflect it directly. Now in that context, when I'm looking at general welfare, what we should do is have regulations that focus on the quality, the delivery, and the accessibility of healthcare for all of our citizens. And in that context, we need to evaluate everything that the government does within the context of those three objectives. If it doesn't comply to those three objectives, we shouldn't be regulating it. You want to drive costs out of the system? Prosecute fraud in healthcare, and then enforce tort reform that focuses on loser pays and vexatious litigation. The other thing we need to do is work within the private sector to identify whether there's an alternative for some sort of catastrophic healthcare insurance. And when we exercise regulatory constraint, we're able to drive towards greater access to quality healthcare at the lowest possible cost.